still have bad breath even after brushing? You're not imagining it. You brush, you floss, you rinse, and yet the smell lingers, the unease stays. That nagging worry before a meeting, the second guessing after a close conversation, the awkward moment when someone steps back. Persistent halitosis is common, frustrating, and almost always solvable once you know where to look. In the next sections, we'll walk through the hidden reasons your breath might stay bad despite good brushing, the quick checks you can do right now, and the simple steps that often make a dramatic difference. We'll break this down into clear categories: oral causes, ENT and sinus causes, systemic medical issues, diet and lifestyle, and medications or supplements, and we'll flag when to get professional help. If this sounds like you, type 1 in the comments and hit subscribe so you don't miss the fixes we'll show you. First, let's clear up a misconception. Brushing your teeth is essential, but it only treats part of the problem. Toothbrushing targets the surfaces of your teeth and, to some extent, the gums. What it can't fully reach, and what commonly harbors the smelly stuff, are places like the surface of your tongue, the pockets under your gums, the crevices in your dental work, and the folds of your tonsils. Add to that the possibility that the source isn't even in your mouth. Sinus mucus, reflux stomach contents, or metabolic changes can all release odors that brushing won't fix. Think of your mouth as a small ecosystem. Bacteria live in biofilms, sticky communities that cling to surfaces. Those bacteria break down proteins and other compounds and release volatile sulfur compounds and other stinky molecules. On a single morning, they might cause the classic morning breath. Over weeks and months, if the environment stays favorable, that odor can become persistent. Here's a short example you'll recognize. Anna brushes twice a day, flosses occasionally, and thinks she's doing everything right. She still notices a musty smell when she wakes, and coworkers have gently told her they noticed it during a meeting. She tried switching toothpaste, bought an expensive mouthwash, and the problem didn't go away. What Anna didn't know, her tongue has a thick coating, and she has early gum pockets that collect bacteria. Brushing alone barely touched those trouble spots. Let's walk through the most common oral reasons first, the places that live in plain sight but are often overlooked. We'll number them so you can follow and check them off. First, the tongue biofilm, the single most commonly missed source. Your tongue isn't smooth like a table. It's textured, full of tiny crevices and papillae. Food debris, dead cells, and bacteria collect there and form a coating. When those microbes feed on sulfur-containing proteins, they generate volatile sulfur compounds, the molecules that smell like rotten eggs or a metallic tang. On a single morning, they might cause the classic morning breath. Over weeks and months, if the environment stays favorable, that odor can become persistent. Here's a short example you'll recognize. Anna brushes twice a day, flosses occasionally, and thinks she's doing everything right. She still notices a musty smell when she wakes, and coworkers have gently told her they noticed it during a meeting. She tried switching toothpaste, bought an expensive mouthwash, and the problem didn't go away. What Anna didn't know, her tongue has a thick coating, and she has early gum pockets that collect bacteria. Brushing alone barely touched those trouble spots. Let's walk through the most common oral reasons first, the places that live in plain sight but are often overlooked. We'll number them so you can follow and check them off. First, the tongue biofilm, the single most commonly missed source. Your tongue isn't smooth like a table. It's textured, full of tiny crevices and papillae. Food debris, dead cells, and bacteria collect there and form a coating. When those microbes feed on sulfur-containing proteins, they generate volatile sulfur compounds, the molecules that smell like rotten eggs or a metallic tang. Clinically, dentists call this a tongue coating or tongue biofilm. In everyday terms, it's the fuzzy, often white or yellowish layer you might see toward the back of the tongue. How do you check it? Gently stick out your tongue and look under good light. If you see a visible layer, especially toward the back, that's a clue. Another quick test. Take a clean spoon or a tongue scraper, drag it from back to front, and smell the residue on the tool. If it smells, the tongue coating is likely a major contributor. What to do about it? Tongue cleaning is simple, inexpensive, and effective for many people. Use a tongue scraper or the backside of a toothbrush designed for tongues. Here's a step-by-step you can try right now. Sit in front of a mirror, open wide, place the scraper as far back on the tongue as is comfortable, and pull forward firmly but gently. Rinse the scraper and repeat 2 or 3 times. Don't gag. If you feel the gag reflex, aim a little forward where it's tolerable and work gradually. Some people prefer an alcohol-free mouthwash first to loosen the biofilm, then scrape. After scraping, spit and rinse. Do this daily. For many people, the improvement is noticeable within days. A short expert note. Most cases of persistent bad breath have a tongue component, says Dr. Ana Morales, a general dentist. People underestimate how much odor-producing material hides on the tongue surface. That's why tongue cleaning should be part of a routine, not an optional extra. A few cautions. Be gentle if your tongue is tender or if you have ulcers. If scraping causes bleeding, stop and see a dentist. Bleeding may point to another issue. Also know that scraping is an addition to brushing and flossing, not a replacement. Second, gum disease and periodontal pockets. Gum disease exists along a spectrum. On the mild end, you have gingivitis, where gums are inflamed and may bleed when you brush. Left unchecked, it can progress to periodontitis, where the bone and ligament that support the tooth are affected and little pockets form between the tooth and gum. Those pockets are dark, moist spaces where anaerobic bacteria thrive. These are the same bacteria that produce particularly foul, sulfurous smells. Importantly, a toothbrush alone often can't reach and disrupt these pockets. That's the job of professional cleaning and, in some cases, more advanced periodontal treatment. How do you suspect gum disease? Common signals are gums that bleed easily, swollen or receding gums, teeth that feel loose, persistent bad taste, or a chronic bad smell that seems to come from deep inside. Many people ignore bleeding because they assume it's normal, but it's one of the earliest red flags. What a dentist might do. During an exam, the dentist or hygienist will measure pocket depths with a probe, take x-rays if needed, and perform a professional cleaning, scaling and root planing to remove calculus and biofilm below the gum line. For more advanced disease, they may recommend periodontal therapy, antibiotics, or referral to a periodontist. Home care matters too. Proper daily brushing with a soft bristled brush, daily flossing or interdental cleaning, and possibly adjunctive antimicrobial rinses as recommended by your clinician. Short expert paraphrase: deep pockets act as odor reservoirs, notes Dr. Michael Reed, a periodontist. No amount of surface brushing will eliminate the bacteria living below the gum margin. These need a targeted clinical approach. Third, tonsil stones, also known as tonsilliths. Tonsils have crypts, small pits and folds, and these can trap food particles, dead cells, and mucus. Over time, this trapped material can harden and form a small calcified lump that harbors bacteria and produces a foul smell. People with visible white or yellowish lumps at the back of their throat, chronic throat clearing, or a postnasal drip sensation may have tonsil stones. The odor is often described as sulfurous or like rotting material. What to watch for? An occasional sharp discomfort in the throat, the sensation of a foreign body, or a white spot visible when you open wide. Some people discover tonsil stones by accident when they cough them up or when a dentist points them out. Self-care and caution: gentle gargling with warm salt water can dislodge smaller stones. Some people use a soft toothbrush or a cotton swab to gently press on the tonsil and encourage the stone out, but that risks gagging, irritation, or infection if done roughly. For recurrent or large tonsilliths, ENT evaluation is reasonable. The ENT may recommend removal in clinic, laser cryptolysis to smooth the tonsil surface,
or in repeated severe cases, tonsillectomy, but those are last resort options for people with chronic disabling symptoms. Fourth, tracked food, poorly fitting dental work, and oral appliances. Fillings or crowns that don't fit perfectly, fixed bridges, removable partials, poorly cleaned dentures, and orthodontic retainers can all hide food debris and biofilm. Even well-fit restorations can develop gaps over time. These sheltered spaces let bacteria multiply and can cause a persistent odor that seems to come from the mouth even if you brush the visible tooth surfaces. What to do? Inspect your dental work if you can. Dentures and removable appliances should be cleaned daily following the manufacturer's instructions. Overnight soaking is often recommended for dentures. If you have crowns, bridges, or implants, and you suspect a smell is coming from around them, book a dental appointment to have the margins checked. Sometimes replacing or adjusting a restoration makes a huge difference. Now, while these 4 oral categories cover the majority of persistent halitosis originating inside the mouth, they often interact. For example, a person with periodontal pockets who also has a heavy tongue coating has 2 active sources.
Addressing only one may give partial relief. Comprehensive care addresses all reservoirs. Before we move on, here are 3 quick checks you can do at home to identify an oral source. 1. Tongue scrape test. Use a clean tongue scraper or the back of a spoon, scrape gently from back to front and smell the residue. If it smells strongly, that's a strong clue that tongue is a major source. 2. The gauze or floss test. Take a piece of dental floss or a strip of gauze and run it between suspect teeth or under the gum line where you can reach. Smell the floss or gauze. If it has a distinct odor, trapped food or plaque may be present. 3. Visual throat check. Open wide in front of a mirror with a strong light. Look for white or yellow spots on the tonsils or an obvious coating on the back of the tongue. These are self-checks, not formal diagnoses, but they help you prioritize what to bring up with your dentist or doctor. Let's pause for a practical moment. What should you do immediately if a self-check indicates an oral source? Start with daily tongue scraping and meticulous flossing, and schedule a dental cleaning if you haven't had one in 6 months. Use an alcohol-free mouthwash for short-term relief. Alcohol-based mouthwashes can dry the mouth and actually worsen odor over time for some people. Consider chewing sugar-free gum containing xylitol after meals to stimulate saliva. But remember, if you have signs of gum disease, bleeding gums, receding gums, loose teeth, don't delay professional dental care. Home measures help but can't replace clinical intervention for periodontal disease. Okay, we've covered the inside of the mouth culprits in depth. Many viewers will see immediate improvement from focused tongue cleaning, better interdental cleaning, and a dental check. But not all persistent bad breath starts inside the mouth. Now we shift focus to a different territory that often surprises people: the nasal passages, sinuses, and throat. These ENT and sinus causes can produce smells that seem oral but aren't. First in this group, postnasal drip. Postnasal drip happens when excess mucus from the nose and sinuses drains down the back of the throat. That mucus mixes with bacteria and debris and can become foul-smelling. Chronic allergenic rhinitis, non-allergenic rhinitis, or chronic sinusitis can all produce ongoing postnasal drip. Because the source is upper airway mucus, brushing your teeth won't change it. How do you notice postnasal drip as a cause? You may have a constant need to clear your throat, a sensation of mucus pooling in the back of your throat, throat clearing or coughing at night, or a taste of mucus. Often the smell is worse in the morning or after lying down when drainage pools. An ENT will evaluate nasal airflow, inspect sinuses, and may recommend treatments ranging from saline irrigation to topical steroids or occasionally surgery for persistent sinus disease. Second in this group, chronic sinusitis. Sinus infections, especially chronic ones, can harbor bacteria and produce thick, fetid nasal discharge. The smell can be strong and persistent. People with chronic sinusitis often complain of nasal congestion, reduced sense of smell, facial pressure, and thick postnasal drip. Because the sinuses are connected to the nasal cavity, infected mucus can trickle into the throat and create a bad breath sensation. An ENT evaluation may include nasal endoscopy and imaging to see the sinuses. Treatments depend on the cause. Antibiotics when bacterial infection is suspected, saline nasal irrigations, corticosteroid sprays, treatment of underlying allergies, and in some cases, functional endoscopic sinus surgery to improve drainage. Third in this group, chronic tonsillitis and recurrent throat infections. Even if tonsil stones aren't present, chronically inflamed or infected tonsils can produce smelly secretions. People with recurrent tonsillitis may notice a persistent bad taste or smell that doesn't respond to oral hygiene because the problem is in the lymphoid tissue, not on the teeth. How should you proceed if you suspect an ENT source rather than an oral one? Track your symptoms. If you have persistent nasal congestion, frequent sore throats, chronic cough, blood-tinged mucus, or a reduced sense of smell, mention this to your primary care doctor or an ENT. Simple interventions, saline irrigations, treating allergies, or addressing chronic sinus infections often change breath quality dramatically. A brief clinical voice. When sinus drainage is the source, we often see patients who have been told to brush more, but the real fix is controlling the nasal inflammation, explains Dr. Ravi Patel, an ENT physician. Treat the sinuses, and the breath usually improves. There's one more nasal throat issue to be aware of: foreign body or chronic infections in the nasal cavity, especially in people with anatomical issues like a deviated septum that impairs drainage. These are less common but worth assessing if more typical treatments fail. At this point, we've worked through two major territories that explain most cases: the oral cavity and the upper airway. Many people will find dramatic relief by addressing these. Others, however, still have persistent odor despite targeted tongue cleaning, a recent dental deep cleaning, and an ENT evaluation. For those people, we enter the next level of the diagnostic map: systemic medical causes, dietary and lifestyle contributors, and the role of medications and supplements. These can be more complex, and they're where the conversation gets investigative, especially around supplements that people sometimes blame for bad breath. We will explore those topics in detail, including what tests to ask for, what dietary shifts can help, and which classes of medications most commonly dry the mouth or alter oral chemistry. We'll also take a careful, evidence-based look at the supplements people often accuse of worsening breath and explain how to approach those concerns safely with your clinician. But before we get there, it helps to consolidate what we've already learned and prepare a short checklist you can act on immediately. Quick checklist for the next 48 hours. 1. Start daily tongue scraping. Do this once per day, ideally after brushing in the morning. Track whether the odor decreases over several days. 2. Be meticulous with interdental cleaning. Floss once daily or use interdental brushes. If you wear fixed bridges or retainers, clean under and around them carefully. 3. Avoid alcohol-based mouthwashes for now if you suspect dry mouth. Choose an alcohol-free antimicrobial rinse or plain saline gargle for temporary relief. 4. If you have visible tonsil stones or persistent throat symptoms, try gentle saltwater gargles and schedule an ENT consult if they recur. 5. Book a dental cleaning and periodontal evaluation if you haven't had one in the last 6 months, or sooner if you notice bleeding, receding gums, or loose teeth. These are practical, low-risk steps that many viewers can start immediately. The surprising truth is that for a large fraction of people, these targeted, inexpensive actions resolve the problem, but only if you address the actual reservoir of odor rather than simply brushing surfaces. Before we move into the systemic and investigative territory, a couple of important cautions.
First, never abruptly stop a prescription medication because you suspect it's altering your breath. Some medications have side effects like dry mouth that may contribute to odor, but stopping them can be dangerous. Instead, document your symptoms and speak to the prescribing clinician. They may be able to switch you to an alternative or suggest supportive measures. Second, be wary of miracle fixes or unverified products marketed to cure bad breath overnight. If something sounds too good to be true, it usually is. We're now at the natural crossroads of this investigation. We've peeled back the common and hidden oral causes and looked at sinus and throat sources. The next phase will dive into systemic metabolic causes, from reflux that draws stomach contents into the mouth to medical conditions that alter body chemistry, followed by diet, lifestyle, and the closely watched medications and supplements segment. That portion will require careful wording because many supplements are commonly blamed without solid evidence. Where evidence exists, we'll explain it, and where it doesn't, we'll label it clearly as anecdotal or mechanism-based hypothesis. We'll also give you a step-by-step plan to present your case to your dentist or physician so testing and treatment can be efficient and focused. For now, take a moment to run the quick checks we described. Notice what changes over the next few days with tongue scraping and more precise flossing. Make an appointment for a dental cleaning if you're due. Track any symptoms that point beyond your mouth: nasal congestion, chronic cough, stomach reflux, unexplained dry mouth, and write them down so you can share them with your clinician. In the next segment, we'll unpack systemic causes like GERD and metabolic issues, dig into how diet and hydration alter the oral ecosystem, and confront the two supplements angle head-on with careful evidence-based analysis. We'll also give you the precise phrasing to use when talking to your dentist or doctor so they understand the timeline and tests to consider. Next, we dig into the systemic, dietary, and medication-related territory, the parts that often surprise people because they're outside the mouth but still change what comes out of it. We'll walk through the mechanisms clearly, give you tests to ask for, and show the exact steps you can try at home. Stick with us. Some of this is counterintuitive, but it's practical. First, systemic metabolic causes you should know about. These are conditions that change body chemistry and can alter breath odor in ways brushing won't fix. 1. GERD and reflux. Gastroesophageal reflux disease allows stomach acid and sometimes small amounts of gastric contents to move up into the esophagus and occasionally into the mouth. When that happens repeatedly, the refluxate can leave a sour, acidic, or sometimes rotten smell. People with reflux may also report heartburn, regurgitation, a bitter taste in the back of the throat, or a chronic throat clearing habit. Because the source is the stomach and esophagus, brushing the teeth won't remove the underlying cause. What we can do right away: if reflux seems possible, try simple lifestyle changes for a couple of weeks and track results. Avoid late-night meals and lying down within 2 to 3 hours of eating. Elevate the head of the bed by a few inches. Reduce caffeine and alcohol, both can worsen reflux. If symptoms persist, burning chest pain, frequent regurgitation, or nocturnal cough, make an appointment with your primary care doctor. They may trial a short course of acid suppression or refer you for further testing if needed. 2. Diabetes and ketosis. Uncontrolled diabetes, especially when the body is in a state called diabetic ketoacidosis, can produce a distinctive fruity or acetone-like breath. Less dramatically, someone following a very low-carb ketogenic diet or using high doses of exogenous ketones can also develop an acetone odor, sometimes noticeable on the breath. If you notice a sweet, fruity, or nail polish-like smell combined with increased thirst, frequent urination, unexplained fatigue, or unintentional weight loss, it's important to check blood glucose. Ask your clinician for a fingerstick glucose or an HbA1c test if diabetes or poor control is a concern. 3. Kidney and liver dysfunction.
Advanced kidney disease can cause a breath described as uremic or ammonia-like because nitrogen-containing wastes build up in the blood and are exhaled. Severe liver disease can alter breath odor too. Classic descriptions include a musty or sweetish smell. These are less common causes of chronic bad breath, but are red flags when paired with other symptoms like yellowing of the skin or eyes, decreased urine output, swelling, persistent fatigue, or changes in appetite. If you have systemic symptoms, tell your primary care provider. They'll likely order basic metabolic labs, including liver and kidney function tests. 4. Infections and metabolic disorders. Certain infections and metabolic abnormalities can produce odors. For example, severe infections in the mouth or throat can be associated with systemic signs. Some metabolic disorders that affect amino acid breakdown can change body odors. These are rare in adults, but the general point is persistent, unusual breath odor accompanied by systemic symptoms deserves medical evaluation. Mini hook. Coming up, the surprising non-food cause that can make your breath smell like acetone. Now let's move into diet, hydration, and lifestyle, the everyday things many people overlook that actually have big effects on breath. First, foods with volatile compounds. It's not just the obvious culprits, but the chemistry behind them that matters. Garlic and onions contain sulfur compounds that are absorbed into the bloodstream during digestion and then exhaled through the lungs as well as released in the mouth. That's why brushing or mouthwash might temporarily mask garlic breath but not eliminate it entirely. The compounds are systemic. Other strong-smelling foods, spices, certain fish, and cheeses can similarly affect breath for hours. Practical swap. If you have an important meeting, avoid heavy garlic onion meals beforehand. If you accidentally eat them, chewing fresh parsley, mint, or drinking green tea can help neutralize odors in the mouth. However, remember that these are masking measures and may not remove systemically produced smells. Second, alcohol and smoking. Alcohol dries the mouth and alters oral bacteriobalance. Smoking adds its own persistent odor and also damages the glands that produce saliva. Both reduce the mouth's natural cleaning mechanism and create an environment friendly to odor-producing bacteria. Third, sugar and processed foods. Diets high in sugar and refined carbohydrates feed the bacteria that produce smelly compounds. Over time, a high sugar diet can shift the oral microbiome toward species that thrive in that environment and produce more volatile sulfur compounds. Swap suggestion: reduce sugary snacks between meals. If you must snack, choose fresh fruit, plain yogurt if tolerated, or crunchy vegetables that stimulate saliva. Choose sugar-free gum with xylitol after meals to boost saliva and help reduce bacterial growth. Fourth, dehydration and saliva. Saliva is the mouth's natural cleanser. It washes away debris, buffers acids, and contains antimicrobial components. When saliva flow is reduced from dehydration, mouth breathing, certain medications, or health conditions, odors persist. This is why dry mouth, xerostomia, is one of the most important contributors to chronic bad breath. Daily routine to boost saliva. Aim to drink water regularly throughout the day, not just when thirsty, because thirst is a late signal. Sipping water, chewing sugar-free gum, xylitol, sucking on sugar-free lozenges, and using a humidifier at night can all help. If you have chronic dry mouth, your dentist or physician can recommend saliva substitutes or prescription stimulants in select cases. Now we reach the medications and supplements block, an area that often creates worry. We'll separate this into two parts: prescription medications and then the investigative supplements segment. Medications. Classes commonly associated with dry mouth or breath changes include anticholinergic drugs, some antidepressants, certain antihistamines, decongestants, some blood pressure medications, and diuretics. The mechanism is usually decreased saliva production or altered oral mucosa, which allows bacteria to flourish.
Some medications can also cause reflux or gastric stasis, indirectly increasing the chance of reflux-associated breath. What to do if you suspect a medication? Don't stop the medication on your own. Instead, document when you started it and whether breath symptoms began after that change. Bring this information to the prescribing clinician and ask whether alternatives exist or whether adjunctive measures, extra hydration, saliva substitutes, timing adjustments could mitigate dry mouth. Short expert paraphrase: many medicines can reduce saliva. When saliva is low, odor tends to increase because the mouth can't clear bacteria effectively, says Dr. Susan Lee, a primary care physician. Work with your prescriber rather than stopping the drug abruptly. Investigative segment: the 2 supplements people often blame, handled cautiously. There's a lot of online noise about supplements causing bad breath. Some claims are mechanism-based and plausible, others are anecdotal. We'll label this as investigative and careful. First commonly blamed supplement: garlic supplements, including garlic oil capsules. Why? Garlic contains sulfur-containing compounds like allicin. These compounds are absorbed during digestion and metabolized into volatile sulfur compounds that are excreted not just in the mouth, but also through the lungs and sweat glands. In short, garlic can cause systemic breath odor. Evidence: the mechanism is well understood and the effect is commonly reported. Practical response: if you take garlic supplements and notice persistent breath issues, consider timing them away from social situations, switching to odor-neutralized formulations. Some commercial products are processed to reduce odor, or discussing with your clinician whether you need the supplement at all. Second commonly blamed supplement: fish oil or omega-3 supplements. Many people report fishy burps or a fishy taste after taking fish oil capsules. This is due to incomplete digestion or reflux of the oil, which can manifest as a fishy breath or belch. While fish oil is not typically a direct cause of chronic oral halitosis, it can create episodic bad breath in susceptible people. Practical response: try taking fish oil with food. Store capsules in the refrigerator to reduce oxidation, or consider enteric-coated versions that dissolve in the intestine rather than the stomach. If symptoms persist, discuss alternatives like dietary omega-3s, fatty fish, or other formulations with your clinician. Important caution for the supplement segment: we're not claiming these supplements cause chronic halitosis in everyone. We're presenting commonly reported, mechanism-based associations and practical steps. If a supplement seems temporally linked to your breath changes, document the timing and discuss it with your clinician. We'll link sources and reviews in the description so you can read the evidence for yourself. Mini Ganchos, stay tuned. Right after this, we'll show the exact step-by-step home routine that many viewers can start today to reduce breath odor noticeably. Let's move into the immediate, evidence-based fixes you can try today. These are practical, simple, and safe for most people. Use them consistently for 2 weeks and track what changes. 1. Tongue cleaning, again, but precise. Use a dedicated tongue scraper or the flat edge designed for tongues on some toothbrushes. How to do it? Rinse the scraper, sit in front of a mirror, extend your tongue, place the scraper as far back as comfortable but not so far you gag, and pull forward in one firm motion. Rinse the scraper and repeat 2 to 5 times. Do this once daily. Morning is usually best. If you have a strong gag reflex, aim a little forward and work gradually. Consistent scraping reduces the biofilm reservoir that feeds odor-producing bacteria. 2. Flossing and interdental cleaning, the correct technique. Use a full length of floss, wrap it between your fingers, slide it gently between teeth, and form a C shape against one tooth, moving up and down to remove plaque from the tooth surface and below the gum line. Repeat for both sides of each contact. If you find floss awkward, try interdental brushes sized appropriately for your spaces. Clean interproximally once daily. 3. Brushing and mouthwash, smart choices. Brush twice daily with a fluoride toothpaste and a soft bristled brush.
Choose alcohol-free mouthwashes if you suspect dry mouth, because alcohol can dry oral tissues and sometimes worsen odor over time. For short-term, strong cases, your dentist may recommend an antimicrobial rinse like chlorhexidine for brief use. Don't self-prescribe long-term chlorhexidine because it can stain teeth and disrupt normal flora. 4. Hydration and saliva stimulation. Drink water continually. Sip rather than gulp so your mouth stays moist. Chew sugar-free gum containing xylitol for 10 to 20 minutes after meals to promote saliva flow. Xylitol also inhibits some karyogenic bacteria. Suck on sugar-free lozenges if you prefer. 5. Dietary timing and swaps. Avoid heavy garlic and onion meals before social or work events. Move toward a balanced diet with whole foods and reduce frequent sugary snacks. If you're on a ketogenic or very low-carb regimen and notice fruity, acetone breath, reassess the diet with your clinician if it's causing worry or systemic symptoms. 6. Nasal hygiene for postnasal drip. Saline nasal irrigation, a neti pot or squeeze bottle using sterile or boiled and cooled water, can reduce mucus buildup and postnasal drip. Use saline sprays and manage allergies with appropriate medications under guidance. If you have chronic nasal symptoms, ENT care often helps where oral measures do not. 7. Tonsil care. Gentle saltwater gargles can dislodge small tonsil stones. If you can see a tonsil stone and it's easy to remove with a gentle press or by gargling, do so cautiously. Avoid scrubbing or forcing, which can cause bleeding or infection. Recurrent large tonsil stones or disabling symptoms warrant ENT evaluation. 8. Denture and appliance hygiene. Clean dentures daily with appropriate denture cleaner and soak overnight as instructed. Remove and clean retainers and night guards nightly. If appliances are old or don't fit well, have them assessed by your dentist. Worn or rough surfaces can trap food. 9. Short-term OTC aids. A baking soda rinse, 1/2 teaspoon baking soda in a cup of warm water, can neutralize acid temporarily and is safe for occasional use. Chewing fresh parsley or mint can help mask odors briefly. Avoid over-reliance on strong mint mouthwashes that temporarily mask odor but don't address reservoirs and, if alcohol-based, may dry the mouth. Now, what about timing and thresholds for professional care? Here's a practical decision flow you can use. If you try the home routine, daily tongue scraping, consistent flossing, alcohol-free mouthwash use, hydration, and xylitol gum, and the smell improves within a few days to 2 weeks, continue those measures and maintain routine dental visits. If you get partial improvement but not full resolution, schedule a dental cleaning and periodontal assessment. Dentists can assess pocket depths, check restorations, and remove calculus that home care cannot reach. If you notice persistent odor despite a recent professional dental cleaning, or if you have any of these red flags, see a clinician sooner. Persistent bad breath lasting more than 2 weeks despite consistent home care. Bleeding gums, receding gums, visibly loose teeth, or long-standing gum swelling. Thick postnasal drip, chronic nasal congestion, frequent sinus infections, or visible tonsil stones with recurrent symptoms. Systemic warning signs, unintentional weight loss, excessive thirst and urination, fatigue, jaundice, yellowing of skin or eyes, decreased urine output, or fever. A sudden change in breath odor associated with new medication changes or new supplements that started around the same time. Who to see first? If the smell seems mouth-centered, you can identify tongue coating, bleeding gums, issues around a crown, or your dentist notices pockets, start with a dentist or periodontist. If nasal symptoms, chronic sore throat, or postnasal drip dominate, an ENT is the right referral. If systemic symptoms or metabolic concerns are present, begin with your primary care physician for basic blood work and targeted testing. Tests you might ask about: dental probing and dental x-rays for periodontal disease,
nasal endoscopy or sinus CT for refractory sinus disease, basic metabolic panel and liver function tests if systemic signs are present, HbA1c and blood glucose if diabetes is a concern, and, where reflux is suspected, trials of reflux management or referral to gastroenterology for further evaluation. A couple of short patient vignettes to illustrate how this plays out. Marcus had persistent halitosis for months despite brushing twice a day and using mouthwash. He tried multiple store-bought solutions with little effect. After our checklist, he started daily tongue scraping, flossing, and chewing xylitol gum after meals. He booked a dental cleaning. At his dental visit, pockets of early periodontitis were found and treated. Within 4 weeks of professional cleaning plus improved home care, Marcus noticed a 70 to 80% improvement and felt more confident at work. Leah had a constant bad taste and smell that didn't respond to dental care. She also had chronic nasal congestion and nighttime throat clearing. An ENT evaluation revealed chronic sinusitis with thick postnasal drainage. After a course of saline irrigation, a steroid nasal spray, and allergy management, her breath improved dramatically within weeks. Small changes targeted to the right source made a major difference. We've stressed prevention and detection, but what about the practical phrasing to use when you actually see a clinician? Here are scripts you can use, short, focused, and clinically useful. To your dentist. I've had persistent bad breath for X weeks, months, despite brushing twice daily and flossing. I've started daily tongue scraping and using alcohol-free mouthwash for Y days without full improvement. I also have bleeding gums, receding gums, dentures, crowns. Can you check for periodontal pockets, assess my restorations, and perform a professional cleaning? To your ENT or primary care doctor. I have persistent bad breath that doesn't improve with oral care. I also have chronic nasal congestion, postnasal drip, reflux symptoms, or bad taste. It started X weeks months ago. Could this be sinus-related, reflux-related, or metabolic? What tests do you recommend? To your prescribing clinician about medications or supplements. Since starting medication supplement around time, I've noticed persistent dry mouth and bad breath. I'm not stopping the medication, but I want to discuss potential alternatives or supportive measures to reduce the dry mouth. A few additional notes and cautions. Never abruptly stop prescription medications. If you suspect an adverse effect, document it and ask for a planned discussion with your prescriber. Also, be skeptical of products that promise immediate permanent cures. If a product claims to kill all bad breath bacteria forever, that's a red flag. Treat any long-term use of aggressive antiseptics or unregulated products with caution. They can disrupt the normal oral ecosystem. Let's return briefly to supplements. A few practical rules for anyone taking supplements who's worried about breath. First, keep a symptom diary for 2 weeks when you start a new supplement. Note timing, how you take it, with food on an empty stomach, and any breath changes. Second, try simple modifications. Take supplements with meals, switch formulations, enteric-coated versus non-coated, refrigerate oils to reduce oxidation, or test short holds under clinician supervision. Third, consult your clinician before stopping or substituting supplements, and ask whether the supplement is necessary based on evidence and your health goals. One more point worth emphasizing: the microbiome. Research is increasingly clear that your mouth hosts a complex microbial community. Some interventions, like overusing strong antiseptics daily, can temporarily reduce odor but may also harm beneficial species. The best long-term approach is targeted: mechanical cleaning to remove reservoirs, professional care for pockets and dental issues, and lifestyle and diet changes that reduce the environment where bad actors thrive. Practical timeline and expectations. If the source is tongue coating or trapped food, you may notice substantial improvement within days of consistent scraping and flossing. If periodontal pockets are the main source, professional cleaning plus good home care usually improves breath over weeks to months. ENT-treated sinus or tonsil issues can yield improvement within days to weeks once drainage and inflammation are controlled. If systemic disease underlies odor, treating the underlying condition is the priority and may require longer timelines and specialist care. Quick, final checklist before we close. 3 immediate actions and 3 next steps to prioritize now. Immediate actions. Do these today. 1. Start daily tongue scraping every morning. 2. Floss or use interdental brushes once daily with proper technique. 3. Sip water throughout the day and choose sugar-free xylitol gum after meals. If no clear improvement in 2 weeks, 1. Book a dental cleaning and periodontal assessment. 2. Track additional symptoms, nasal congestion, reflux, dry mouth, systemic signs, and bring them to your primary care or ENT appointment. 3. Review current medications and supplements with your prescribing clinicians. Don't stop them on your own. And finally, when to escalate urgently. If breath changes are accompanied by systemic signs, extreme thirst and urination, sudden weight loss, jaundice, high fever, or decreased urine output, seek medical attention promptly. These can be signs of serious systemic conditions. We want to close with reassurance. Persistent bad breath is common, and in most cases, it's manageable. The key is to find the reservoir, the tongue, gum pockets, tonsil crypts, sinuses, or a systemic source, and target it with the right care. Small daily habits, done correctly, often produce outsized improvements. If you found this helpful and want a step-by-step guided demo of the exact tongue scraping, flossing, and interdental brush techniques we described, check out the next video in the description that walks through each movement with close-up visuals and recommended products. We've also linked reputable sources and a reading list in the description so you can explore the evidence on diet, reflux, and the supplements we discussed. If your breath still won't budge after consistent home care and professional evaluation, don't despair. There are diagnostic pathways and specialists who can help. Persistent halitosis is a clue, not a sentence. With the right team and the right steps, most people regain confidence in weeks to months. Thank you for watching. If this video helped you understand what to check and what to tell your clinician, leave a comment about which tip you'll try first. And if you want more deep dive guides like the hands-on dental hygiene demo or an ENT-focused look at postnasal drip, subscribe and watch the next video linked on the screen. If this persists, see a dentist or your doctor so they can identify the specific cause and tailor care to you.